From the PEP Radio Newsroom, this is the evening news blast for April 23rd, 2025. The Washington Blade is reporting that the U.S. Department of Health and Human Services is planning to retire the National 988 Crisis Lifeline for LGBTQ youth on October 1st, according to a preliminary budget document obtained by the Washington Post. Introduced during the Biden-Harris administration in 2022, the hotline connects callers with counselors who are trained to work with this population, who are 4 times likelier to attempt suicide than their cisgender or heterosexual counterparts. Suicide prevention is about risk, not identity, said James Black, CEO of the Trevor Project, which provides emergency crisis support for LGBTQ youth and is contracted with HHS to take calls routed through 988. Ending the 988 Suicide and Crisis Lifeline's LGBTQ plus youth specialized services will not just strip away access from millions of LGBTQ plus kids and teens, it will put their lives at risk, they said in a statement. These programs were implemented to address a proven, unprecedented, and ongoing mental health crisis among our nation's young people with strong bipartisan support in Congress and signed into law by President Trump himself. I want to be clear, all LGBTQ plus young people, this news, while upsetting, is not final, Black said. And regardless of federal funding shifts, the Trevor Project remains available 24/7 for anyone who needs us, just as we always have. The service for LGBTQ youth has received 1.3 million calls, texts, or chats since its debut, with an average of 2,100 contacts per day in February. I worry deeply that we will see more LGBTQ young people reach a crisis state and not have anywhere that they're able to have help them through that, said Jansen Wu, Director of Advocacy and Government Affairs at the Trevor Project. I worry that LGBTQ young people will reach out to 988 and not receive a compassionate and welcoming voice on the other end, and that will only deepen the crisis. Under Trump's HHS Secretary Robert F. Kennedy Jr., the agency's departments and divisions have experienced drastic cuts. With a planned reduction in force of 20,000 full-time employees, the Substance Abuse and Mental Health Services Administration has been sunset and mental health services consolidated into the newly formed Administration for a Healthy America. The budget document reveals, per Mother Jones, further sweeping cuts to HHS, including a 40% budget cut to the National Institutes of Health, elimination of funding for Head Start, the early childhood education program for low-income families, and a 44% funding cut to the Centers for Disease Control, including all the agency's chronic disease programs. If you are watching our videos on YouTube, please subscribe to the PEP Radio channel. Download the Live 365 app to take PEP Radio with you wherever you go. Coming up, we have the National Weather Service forecast for the Meadville area on PEP Radio.